Good afternoon. I would like to welcome you back to the Social Determinants of Health track. My name is Cindy Buckles, and I will be your host as well as one of the presenters today. Just a couple of housekeeping items before we get started. If at any time during the session you have questions, please be sure to put those in the question and answer box so we can attempt to get to those. And then also the conference materials can be found in the handout section or in the resource panel below the questions module. Today's session is entitled How to Achieve True Member Centricity. And if we could get to the next slide, I'd like to introduce the presenters today. As I said, I'm Cindy Buckles. I'm the Director of Outcomes of Community Growth with Signify Health. We also have joining us Kara McGrain, who's the Director of Initiatives and Partnerships with Kronkosky Charitable Foundation. Jackie Rivera, who is Population Health Strategy Lead with Humana, and rounding it out with Julia Weatherly, who is a Senior GM STARS Program Analyst with Independence Blue Cross. So very excited about the people we have with us today. And wanted to start with a member story. And we're using Jane, a 75-year-old woman, and Jane is one of the thousands of people who have social factors that affect their health. And what we have historically seen and what we've done in the past is we've looked on this left-hand side at the clinical needs. And we know through claims information that Jane is a diabetic with hypertension. She's been diagnosed with depression. Her annual checkup is overdue, and she has had 10 ED visits in the last 3 months. So at first glance, Jane appears to be non-compliant. But as you get to know her and as you get to understand what's going on in her life, you see that she's recently widowed, she's lonely, and she has poor nutrition. She doesn't drive, which makes it difficult to get to the grocery store or to her doctor's appointments. And she really lacks that support system that is so vital for all of us as we move through our life journey. So as we learn these things about Jane, well, what do we do with that? Next slide. Well, this is part of the approach, and it looks very busy and very overwhelming, and it's supposed to. When organizations and communities start thinking about going down the path of doing things differently, it can seem overwhelming. There's so many pieces and parts. Oftentimes the project fizzles before it even begins. So we are excited today to present and share that it is possible to bring the pieces together. Kara and Jackie and Julia are going to go beyond theory and share the reality of their work. Next slide, please. So they're going to show us what the innovative solutions are that they've put in place in their respective markets. And so now I'm going to turn it over to Kara to discuss her work.
Thank you, Cindy. Hi, everybody. Thank you for joining us today. So as I said, I'm Kara McGrain. I'm with Alamo Area Community Network. And the Alamo Area Community Network brings together community-based organizations, payers, providers, and medical providers and funders working in the Signify Health platform in order to impact the well-being and health of our community. And so this sounds like, oh yeah, sure, that's a nice concept, right? But ultimately, as Cindy just said with the busy slide, it's hard work. It's very, very difficult. And so often we're very well-intentioned as stakeholders, whether we are funders or community-based organizations or payers, and we really want to impact this social determinants of health realm of our world. However, in order to do so, there's a lot of silos to be broken down. There's intense levels of communication and transparency that need to happen. And so I'm going to share a little bit with you about the Alamo Area Community Network, what we do, how we came to be, and what this means for what we're doing in San Antonio, especially with Signify and with Humana Gold. So the Alamo Area Community Network, again, it's more than an electronic platform. Jackie can smirk at this because we talk about it every day. People are like, oh, it's nice. It's an electronic referral platform. It is significantly more than an electronic referral platform. We talk all the time about community-based organizations or faith-based organizations, and we mean our nonprofits and our faith-based people who are providing these direct services. And with the advent of the term social determinants of health and some indicators around that, what was really understood is that ultimately community-based organizations and faith-based organizations have been solving for these things now called social determinants of health for centuries. And this is what we do as community-based organizations, but we often are not, as community-based organizations or nonprofits, resourced with tools to do that work, break down the silos, and impact bigger systems change. And we'll talk a little bit later about what that means to payers and providers and funders, but wanted to just level set that we want to make sure that there are community-based organizations and nonprofits who've been solving for this, and the 80-90% of social determinants of health are finally realized we're solving for it, and that we now want an equitable voice at the table. We want to have that seat where we're not treated necessarily as nice little nonprofits, nice little charities, but people doing really great work that has a fiscal impact on our community and our health systems. Next slide. So, paradigm shift is a term. We all use it in so many different ways, but truly what we're aiming to do here in San Antonio with the Alamo Area Community Network is a fundamental paradigm shift. As I just outlined some of the reasons to why we want to influence that. But our big goal is that if we, as through exampling the Alamo Area Community Network, we can influence and impact the CMS billing codes to make sure that those of us solving for social determinants of health have that resource that funnels down to our community-based organizations. And this is more than just getting paid for that good work we've been doing for centuries. It really has a fiscal impact on our community. So when you think about funders, so I am representing Kronkosky as well as the Alamo Area Community Network. When you think about funders, we're funding through grants organizations to do that work every day, but we aren't necessarily helping them create bigger systems impact change. And if we aren't doing that, then we create this cycle of community-based organizations or nonprofits being dependent upon funders and state systems and local systems to fund that daily work. But if we could mechanize how we impact the CMS billing down to CBOs, it creates another set of earned income for those organizations so that they can focus on other things like sustainability and upstream issues. I think the other thing that we really want to talk about with this is that when COVID happened, it was really an inflection point for many of us or many people who weren't necessarily in this realm. But when the bottom fell out of our world and our communities, it was community-based organizations and nonprofits and faith-based organizations that were doing the yeoman's share of the work to help keep families afloat and sustained. But at the end of the day, those community-based organizations needed more money from funders. They needed more. They were losing money, so they had less staff, and of course, their donations and their volunteers, which all equates to resources, was grossly hindered. Next slide. So when we talk about the goal of the Alamo Area Community Network, there's many, of course, but as I've just shared, it really is to increase collaboration. And I say big C collaboration versus little c collaboration. Little c collaboration is nonprofits and funders saying, yes, we'll send referrals and we'll share with one another. But big C collaboration, as I say, is really being transparent, honest, and vulnerable with one another and putting down some of our own agendas. You still have your mission, vision, values, that won't change. But how can we help impact a whole system rather than just our silo? We want to identify, we identify needs and patterns for clients. Obviously, we're capturing the social determinants of health. We're utilizing the prepare. We reduce duplicated efforts, and then again, gather cross-sector evidence to really change that. So the next slide, please. And so we wanted to let people know, and we have this conversation so often, is that the Alamo Area Community Network was not just like launched. We said, oh, let's pick some tool off the shelf and just throw it into San Antonio and tell everybody to play in the sandbox and see how that works. We really are very proud at the Kronkosky Charitable Foundation to know that this has been a multi-year project for us. The Kronkosky Foundation funded a project called Autism Lifeline Links, which I've led for 4 years, utilizing the Signify tool to really impact that autism sector. And we have been able to impact public policy the last 2 legislative sessions and are changing the Texas Administrative Code this session. So I tell you this to let you know that what we are doing is modeled upon something that we did very well as a community for the past 4 years. And we have impacted legislation, but we've also changed hearts and minds. We do this through also work groups that are stakeholders from all over the community in 4 different work groups that come together to really talk about the why and why is it broken instead of just complaining that it's broken. Why is it broken? How do we fix it? What are we willing to do about it? And so it really started from that, and us and Autism Lifeline Links wanting to send more electronic referrals in the Signify platform to more than just our disability partners, workforce development, food security, so on and so forth. At the same time, in San Antonio, United Way Hopes project and United Way Dual Generation projects were also utilizing Signify for custom work. And then Connectability at Warm Springs, which is a acquired brain injury, traumatic brain injury group, was using it. And so ultimately, when we launched the Alamo Area Community Network, it was with those entities that had already been using Signify in their own work and finding it very helpful. So when we launched in September, we really thought it'd be important to have a payer at the table to help us to influence that and help do some of that work, as well as a provider. So that's when Humana and Jackie and the Humana Bowl Gold team came into our world, and so thrilled for it, as well as Communicare, which is one of our FQHCs here in San Antonio. So we launched with those partners that were already using Signify, as well as those entities. And of course, that's United Way, Kronkosky Charitable Foundation, Warm Springs Foundation, Humana, and Communicare. Well, then our friends at the City of San Antonio were always going, in the Department of Human Initiatives, they were always going to join. We've been in conversations for 2 years. They were, yeah, sure, we're going to come in when we're ready, so on and so forth. And then COVID happened. And our community developed a recovery resiliency plan. And in that recovery resiliency plan, it was mandated that the City of San Antonio create an electronic platform for community-based organizations to connect people to services. And I say all the time, thank the blessed Lord, we'd already been doing this and we had launched, because then the City of San Antonio and the Department of Human Initiatives really then just amplified and added another, as we're onboarding those other 50 organizations. And so I know I'm at time, but that's just this, wanted to give you an idea about who we are and what we do. And it's, again, more than a system. We're really looking to impact change, but we can't do that without the medical community, the payers, and the providers like Humana and tools like Signify. So that is it for me. And I am now going to turn it over to my dear friend and colleague, Jackie Rivera with Humana.
Thank you so much, Kara. I of course love the work that you and the AACN and Kronkosky Foundation are doing in the community space. What you and the organization have been working on for the past several years is, we talk about this all the time, a game changer, especially when we think about total person health and true member centricity. And so I think because of all that work that Kara and the AACN had already had going on, Humana's efforts have aligned so perfectly, and we've landed on I think a fantastic partnership with both the AACN and Signify community in San Antonio. Before I dive into the partnership piece, I'll start with a little background of Humana's population health strategy. So if we go to the next slide. Brief history. So Humana launched what we call our bold goal strategy about 6 years ago. And that strategy, of course, was us doubling down on our commitment to improve the health of our communities and our members by making it easier for them to achieve their best health. And so with the launch of this strategy, we of course started with very much a community focus. And so we selected a handful of markets. San Antonio was actually our very first bold goal market. And so we launched into what we call our research and discovery phase. And that really was us just doing a landscape scan to figure out what did health look like in these communities. What were the priorities that they were up against, the barriers that they were struggling with. What did community health look like for them, and what were their goals? Again, when we started, it was really to get a deep understanding of community health, and then of course to support those efforts as best as we could. 6 years later, 6 years later, we're still focused on community health, but we've learned a lot, and you know, Kara and Cindy both kind of alluded to it, but the obvious fact that health doesn't just happen in a doctor's office. I mean, I know that seems really obvious, but when you think of health, we tend to overlook that fact, and I think this is something that the industry, not just Humana, but the industry has really started paying attention to over the past few years, specifically with the focus on social determinants of health. And so we've learned the significance of looking at social and economic factors, and what impact those have on a person's health. So if 60 to 80% of what makes a person healthy is impacted by non-clinical factors, we have to look at the whole picture, right? We can't just focus on one aspect of it. So this priority to focus on integration of clinical and social care in the same ecosystem became very obvious. And Humana realized and recognized that it wasn't enough to just support community work as they address social health, but we really needed to look internally at our own workflows and processes and operations to figure out what we needed to do to change in order to be part of that conversation. So if we go to the next slide, we kind of look at some of the, I guess, the progress that we've had in this space. One of the things that we decided on was, you know, if we were really going to make change and not just have this be a side project, that we really needed to look at our approach to social health, not just from a community perspective, but from an enterprise perspective. And so we started looking at things and programs and interventions that really incorporated this social health lens on what we're doing. And so to that end, we have made some progress in this space. This slide it's very, very busy, and I won't read everything, but I'll touch on a couple of things. The first thing being the screenings. So to be completely transparent, if we were to ask Humana or probably any other healthcare provider several years ago what social determinants of health screening looked like, I think everybody would agree that it wasn't very robust. It wasn't very formal. Sometimes it wasn't happening at all. And one of the lessons that we learned was, you know, in order to really look at social health, you had to figure out how our patients were dealing with social health. So we had a big push on SDOH screening. And this data is a little outdated, but at the end of 2020, Humana had reached 3.5 million SDOH screenings enterprise-wide. I think if I'm being honest, I think now, March 2021, we're probably looking at closer to 6 million screenings. So that means social determinants screening is becoming part of our workflow. We're not just doing it in small markets. We're looking at it at a national level, enterprise-wide, of how we can identify where our members are struggling with social needs. The other thing I'll call out, because I do think it's a fantastic program and a fantastic win, but with COVID and with the pandemic, you know, so many things came to light, and the fact that our members were struggling with food insecurity as their primary social need became painfully obvious to us. And so we were able to launch an initiative because of the pandemic that really helped us deliver over 1 million meals to our members through this new program who were struggling with food insecurity because of the pandemic. if you go to the next slide, I think the biggest shift that we have seen, or I guess the biggest need that has come up is we need a better way to connect clinical and social health, right? And I don't think this is new. I think everybody in this session could probably agree that this is a priority. And so for Humana, we started exploring the need for these closed loop referral systems. Call them electronic systems, call them whatever you want, but it was really this idea behind this closed loop referral system. And so along those lines, Humana launched a project, or a series of projects actually, of what we internally refer to as SHARPs, which really gets at these social health access referral platforms. Basically, the technology that allows care coordinators to not only screen for social determinants of health, but also to be able to better connect our members to community resources that address social health. And then downstream to understand the impact that has on our members' clinical health outcomes as well. And so San Antonio is one of the bold goal markets where we've launched this project, and that is in partnership with the AACN and with Signify. So with all of that background, I hope you're starting to see why our partnership with the AACN is so crucial. Healthcare and community segments are on the cusp of a shift, and we want to be the driver of that shift. And we can't do it alone, right? So healthcare can't drive this change just within the healthcare segment. Community can't drive that change just within the community segment. Kara alluded to it earlier, but it really is about this collaboration, and this collaboration on a deeper level, at a deeper capacity that is beyond just this top level superficial sponsorship type of relationship. So it's necessary to co-create an approach that does tie that clinical and social care into the same setting. And so we think, and I think Signify and AACN would agree with me that this approach truly does allow us to keep the member at the center of everything that we do, because we're untangling this current disconnect that our members face when it comes to achieving their best health. And so instead of putting responsibility on members to kind of seek assistance and guide their own path, through the partnership with AACN and Signify, we're better able to direct our members to community resources. And of course, because the AACN has established such a strong structure, they're even further reducing that fragmentation because they have a reliable network of community-based partners and organizations. So priority one benefit of this is that it provides relevant, tailored, and timely information to the member. That's of course the main priority, keeping the member at the focus. But also thinking of our clinical partners, it creates a longitudinal record of social needs. So instead of just treating these issues in an isolated way, we're creating a more robust record of how this impacts our members, both from the social aspect as well as the clinical aspect. And I think, this might be me being overambitious, but I think it creates the efficiencies and it really improves the accuracy for our care coordination teams to offer a better experience for our members. And then, of course, you think of the downstream impacts. We all have this hypothesis that when you address the social needs of a member, their clinical outcomes will of course be impacted. And so this partnership, this project that we've started is really hoping to have some proof points behind that hypothesis. So there was a lot of information I threw at everybody really, really fast. And this is really just to describe the great work that's going on in San Antonio. And we have partners and counterparts all over the nation who are doing the exact same work. And so with that, I'm going to hand it over to Julia from Independence Blue Cross to talk a little bit about her work that they're doing in her markets.
Thanks, Jackie. So hi, everyone. My name is Julia Weatherly. I'm based here in Philadelphia, so far away from San Antonio, different weather, although you'll see the sun coming in from behind me. It's a nice break from the rain we've had the last few days. I have a public health background, so I have a master's of public health from the University of Pennsylvania. After I graduated, I came to work for Independence Blue Cross, and many of my classmates were upset at me, making fun of me. Why would you go to the big bad wolf? Is that really public health? Many of my classmates, of course, went on to work in government and nonprofits, or went off to get their PhDs and work in academia. But I'm really passionate about public health work that can happen in a business setting. I have experience working for a nonprofit. I have experience in government, and I also have experience working in academia and research. And I feel like this multidisciplinary approach that I take to doing this work has really benefited our community network, which we call Community Link. Independence Blue Cross has been in the Philadelphia area for the last 80 or so years. So we've been here in Philly. We know Philadelphia. We know our members and the communities that they live in. And Philadelphia has many challenges. We are one of the poorest major cities in the United States. And I think a lot of times people associate social determinants of health with poverty. And people knew that social determinants of health existed in Philadelphia, but people weren't so convinced that they existed for folks that had private insurance. Why would someone who can pay a premium also experience social determinants of health? And so I think it takes people like us that come from these multidisciplinary backgrounds to prove to people who may not have the training or the experience or the living in the community to understand that social determinants of health isn't just about poverty. It's so much more than financial restrictions. How do you quantify or associate loneliness with income? You can't, because there is no relationship between income and loneliness. And so we stood up Community Link at Independence Blue Cross because we were starting to realize that many of our Medicare members, who are, of course, over the age of 65, weren't necessarily compliant. We care about things like, did you go get that mammogram? Did you go get that colonoscopy? STAR measures, and other things like that. Of course, we want people to have a positive perception of us, but what we realized is that if you want someone to go get a mammogram, it may not be top of mind if their daughter just passed away, or if what Cindy was showing us, if they lack transportation to get to the pharmacy to pick up their diabetes medications. And so if we start to solve for some of those social and economic factors that people experience, maybe we'll have a positive impact on things like STARS. And so today, Community Link has been here in Philadelphia since June of 2020. We launched in the middle of the pandemic, perfect time. And the pandemic hit Philadelphia really hard, as it did in other areas of the world. But in Philadelphia in particular, what we also saw was similar to what Jackie was saying, in that many of our members and people in the community experienced food insecurity. And I think people don't realize that, of course, we as human beings help and interact with others other than just ourselves, right? So people have income, but they're sharing it with their daughter or their grandchildren. And so what we see on the insurance side is, okay, well, you aren't part of a Part D subsidy, or you're not enrolled in a state kind of prescription assistance expense program. You don't clearly have financial strain. That's not true. And so we needed to develop a more deeper understanding of our members. And so with the launch of Community Link, we've also created our own social determinants of health questionnaire that we pulled from after looking over prepare assessments. We talked with some of our nonprofit partners to understand what questions they asked, and we created our own. And so I'm very proud of Community Link, very proud that we launched in the middle of the pandemic. And if you go to the next slide, I can highlight some of the things that we've done. So like I said, we launched in June, which was very aggressive, but today we have 16 organizations that have joined our network. And we partnered with organizations that we knew were kind of big players in Philadelphia. So if you're from Philly or from New Jersey, you've probably heard of organizations like Humana, Philabundance, even Project Home, who we've partnered with to do this work. And they're part of our network, which is really exciting. So we partnered with organizations that we thought our members, our Medicare members, would probably be referred to the most, but also organizations that we knew were in the community and who the community really turned to in times of need. And so today, those 16 organizations are composed of really hyper-local organizations, some that only have 10 full-time employees, and we have a few other organizations that are part of our network that are more national, like Well Spouse Association. And so we're starting to really understand, as we work through our members and we assess their needs, we're starting to understand just how diverse people's needs are in the Philadelphia area. Food being one of the top 5, but we also have mental health. As you can imagine, the pandemic really exacerbated, I think, people's sense of loneliness, people's inability to kind of unplug and find that outlet that they may have participated in or done before the pandemic was all of a sudden limited to them. I know some people use retail therapy as a way, shopping, nails done, hair done, all those things that we use as self-care, all those things were limited to us and we couldn't participate, and all of us were forced to kind of shift and find a new way to cope with the pandemic. But I think loneliness and mental health were really brought to light through the launch of Community Link. And so far, we've made more than 2,200 referrals to local organizations to, like I said, a variety of big and small organizations. And so our hope is that as more shots go into people's arms, organizations in the Philadelphia area will start to open up. Their services will be kind of restored. Many organizations, as I'm sure in other parts of the U.S., weren't able to and still haven't really opened up fully to what they were doing before the pandemic. And so our job as part of this Community Link project is to not only understand the needs of our population or the people that live in Philadelphia who don't necessarily, by the way, have Independence Blue Cross insurance, is we really want to understand the needs of our community organizations and find ways that we can support them in either opening up and doing more services or what they need kind of on the back end, what they'd like to see from the platform, how we can enhance their overall processes to help people in the communities. Next slide. Okay, I think I turn it back to Cindy.
Yes, thank you, Julia. And this kind of brings us back to that rather complicated, busy slide that we had at the beginning, and really looking at through the things that Kara and Jackie and Julia have talked about, the work that they're doing, they've really brought it down into, something that's manageable, capturing the data, generating insights, improving the outcomes, delivering actions, really just getting down into the work on the ground and getting that to happen. And so some of the key takeaways that we want to talk about, and next slide, is, healthcare spending continues to rise, and it's critical to take a new approach, an innovative approach to address that 60% of what influences health, the social determinants. And as I think we've all taken away from the things that Jackie and Julia and Kara talked about, being person-centric absolutely requires you to be community-centric. No one organization, no one person can do this on their own. It does, in fact, take an entire community. And, one of the things is that we must, partner in strategies that address SDOH. Instead of working in silos, we need to learn how to work together and to share that information. And knowing that the total health happens in and outside the clinical walls. And I think, Julia will definitely agree with me that public health work can happen with a grassroots approach in a business setting. You just really got to get in there and start working together and making that happen. And then, taking that health homeward, keeping the members in their home where they're happiest being and enabling them to be their very best self there really empowers that member centricity. So next slide. That was pretty much the presentation, but now I think that we have saved some definite time for some questions and answers. Julia, you mentioned that you had around 16 organizations as part of your network. Are those the only resources that are available to serve members?
Definitely not. They are those organizations that are part of our network. They can receive referrals and they go through that privacy-enabled platform that we have where we can share the longitudinal social record with the participating organization, but we make referrals to hundreds of other organizations that are within the Philadelphia and kind of 5-county area. And so we're always also trying to figure out what other organizations make sense to come onto the platform by taking a look at the data that we're collecting on the needs of our membership, as well as data on where people are being referred to. But no, people can be referred to more than just the 16 that are formally part of our network.
Thank you. And we did have a question posted in the question and answer section that they were curious on the closed loop process. How are you capturing whether or not someone presented at the referral location you directed them to? And I can, answer part of that with the social care coordination, really, coming alongside that member to make sure that the care happens, following up with them, not just providing a resource and then hoping that they get to that. Is there anything that Jackie, you or Julia would like to add to that?
Yeah, I will add to that. I agree, Cindy, your comments about the importance of the social care coordination. I think I think for Humana, what we've seen is that has been a real driver of making sure that we capture that information correctly and accurately. I think specifically to the question that was asked, I think the technology of the platform really does enable us to capture a lot of fantastic data points. So, we would be able to see, was that referral made through a social care coordinator, or was it made, from a CBO, a community-based partner? And so I think the luxury of having this platform and this connectivity is we're able to see that. Previously that information was not in our scope. It wasn't in our purview. But now, because of the use of the technology, we have that record, right? We have that track that shows us this. But yes, Cindy, to go back to your point about the care coordination, I mean, it is crucial, and the conversations that the care coordinators are having with the members. I mean, it's not just a cold conversation. It's not just a cold screening. It's really a discussion and a partnership that I think drives the success of this, really.
So what do you think that is unique or special and moves the needle with the social care coordination? What are those unique items that you've really noticed?
I think I think, and I know Kara could probably speak to this better, and we're having some technical issues, but I think this true listening conversation. I know that care coordinators that we work with use a lot of what is that term?
Motivational interview.
Yes, thank you. Motivational interviewing is key. So, previously, when you think of, the standard interactions, it's a series of questions and can be very, very cold and can be very not personal, but the social care coordinators are taking these conversations to a deeper level. And I think I can't think off the top of my head of the amount of time that the care coordinators are having with our members, but it's substantial. We're not talking about a 2 to 3 minute conversation where they're asking questions 1, 2, and 3. They are having conversations and discussions, and this has been a little bit of a shift for Humana, if I'm being perfectly honest, because we're used to, I think Julia can agree, it's a business, and you're used to having these scripting questions, but the anecdotally, the stories that are coming out of the care coordinators is just this wealth of information that we would have never gotten if we would simply ask, are you hungry, or do you struggle with food? So Kara, I see you're back on. So I don't want to speak for you, but just the role that those social care coordinators play in all of this is huge.
Absolutely. Again, so many apologies. I've never had internet problems at work, but of course today's the day. So we use the care coordinators to make sure that nobody falls through the cracks here in San Antonio in the Autism Lifeline Links program, because community-based organizations, again, are very taxed. They're under human capitalized. So referrals can be done, but sometimes if that loop isn't closed. So how we've structured it, in addition to care coordinators and our custom work, is that in order to be a member of the Alamo Area Community Network, each organization agrees to have a designated user program person to receive those referrals, and has the expectation to respond to that client within 3 business days and document it in the system. So that'll be a lifelong adoption over time to get users to do that and mechanize it. But those components, building in that infrastructure to make sure that it's more than a platform, but we're making sure that loops are closed and warm handoffs are done. And then, the care coordinator work, which is not necessarily part of the AACN structure at this time, but likely in the future. How do we make sure that we're not just sending a referral, and that we're really closing a loop and making sure that they self-availed and completed registration or received services?
I think I would just.
Oh, I'm sorry. You go right ahead.
I just wanted to add. I think what we're also learning is to do this work, to really do it well, you have to build trust with the other person. And so at IBC, we're seeing, it takes the second, third, fourth phone call for someone to actually reveal the kind of true circumstance of what they're going through. I mean, can you imagine getting a cold call and being asked if you're hungry or if you're alone? I think for me, I'm part Sicilian, and so I was taught to never reveal too much about yourself to strangers. And so I think that was another learning curve for us at Independence Blue Cross was, okay, this is going to take time, and you have to maybe set program goals for that have longer timelines than other kind of vendors that we work with or other programs that we stand up where you just turn the light switch on and walk away and it's running, calls are happening, and it's not like that. I think it takes the third, fourth phone call for someone to actually say and recognize the familiar voice on the other end of the line and say, oh yeah, I am having a really hard time.
I love that. And I think when I talk about paradigm shift, especially from the funder and community-based organization, not necessarily the payer lens, is that what this project, again, beginning with Autism Lifeline Links and moving into ACN, has done is help funders better understand that change over time is how we really address these social determinants of health. You can teach a man to fish, right? You can teach him to fish, or you can give him the fish. And so how do we, even as funders, change our perspective about investing in community-based organizations and the work that they're doing, giving them the tools like Signify, help them have human capital to do the work? That is that long component. And I love that, Julia, because it's not just one and done. It's not a service and gone. It takes a long time to build that trust and change over time. Yeah.
All right, ladies, this has been awesome, and we are at time. So a couple of questions, unfortunately, are going to go unanswered. I want to thank you all for your time today. It has been really inspiring to hear from all of you, and really appreciate it. I do want to remind everyone we're going into a 15-minute break, and we would love for you to also take time to do the evaluation process, and would love to see you back around 3 o'clock for the in-home health risk assessment program, Close Encounters of the Right Kind. So thank you, enjoy your break, and we'll see you in about 15 minutes.